Hello everyone, this is Dr. Stan Gross. I want to speak today about one of our more popular products called Thyrogenesis, restoring metabolic health naturally. So, why is this important? Well, what's the number one deficiency on the planet? Do you know? Well, a lot of people say, well, vitamin D3. Well, that's actually probably number two. Number one is iodine. Yeah, iodine. Remember that stuff that they used to put on open sores to help them heal and kill the bacteria? Iodine. It's actually a mineral. Most people aren't aware of that. These days, iodine is deficient because, well, used to be in our salt, table salt. Now there's an unusable form of iodide in our table salt. Used to be in our bread too, in our pasta, but they replaced that with bromide. Bromide's actually toxic. If you take in too much bromide, it'll replace the potassium in your system and your heart will stop beating. So, another reason to skip refined carbohydrates. So there's foods that are rich in iodine, like cranberries and watercress. I bet you have that every day, don't you? What about seaweed? Yeah, every once in a while for those of us who enjoy sushi. Sushi, by the way, isn't raw fish. Sushi describes the rice, and there's seaweed typically wrapped around that rice, and it's the seaweed that has the iodine and iodide combination. It's good for us, and you can have it stuffed with like avocados and cucumbers and veggies and asparagus. I love all those things, and not have raw fish at all, and it's still sushi. Okay. Sea salt, Himalayan salt, also has iodine and iodide in it. Strawberries, for those who are not allergic, they're a good source, but they're seasonal, right? Fennel root more than the seed. We don't have that very often, I'll bet you. Broccoli, a lot of people love broccoli and a lot of people hate broccoli. I think it's almost a 50-50 draw. Coconut oil, there was a time when medical people would tell you, don't touch tropical oils, they're bad for you because they're saturated. Well, they're medium chain fatty acid. They're not long chain fatty acid like pig fat or cow fat or butter, but medium chain fatty acids actually help break down plaque deposits in the arteries. So coconut oil is good for that. We have a purified coconut oil. We'll discuss that a little bit later on. And then, of course, there's spinach. And we just don't have a lot of this in our diets. We just don't. And therefore, we're what? We're deficient. So what happens? Well, you see hair loss and it gets fine and it becomes straight. The curls disappear. Bulging eyes. Facial flushing. The throat gets thicker because of enlarged thyroid. Tachycardia means the heart races. Systolic BP increases, means that the resting heart never gets a chance to rest. Breast enlargement in women, but not in a good way for them because it's tender. There's weight loss, but there's not predictable weight loss. And it's generally up and down. And in some cases where the thyroid goes crazy, there is weight loss to a point, and then there's that plateau that you can't get beyond. That last 15, 20, or 30 pounds will not disappear. That could be thyroid. Localized edema in the ankles and calves. Oh, you bet. Muscle wasting. Inability to hold on to lean body mass to keep those muscles strong. Finger clubbing. Sometimes associated with respiratory problems. This type of finger clubbing says your metabolism is shut down. And then you generally also see striations in the fingernails and weak, brittle fingernails. And there's tremors, there's diarrhea, and there's menstrual changes or amenorrhea where the periods are painful when they're there and sometimes they don't show up, but you still get the cramping. What a bummer. And for men, a lot of these same symptoms cross over. And the problem is most blood tests are woefully inadequate because the doctors, they'll order thyroid stimulating hormone or T3, T4, but they won't go through the other tests that actually measure thyroid function or parathyroid function. They're only interested in the total function of the thyroid. Is it producing thyroxine? And if it's producing enough thyroxine, well, then your metabolism should be good. Well, no, that not, because it can be producing an adequate amount of thyroxine, but the uptake is poor. So we need to take a closer look at that, right? There needs to be a balance, and the balance issue between iodine and iodide. Iodide is what you might call the conjugated form of iodine. That's the next level. And what it does, that helps not only trigger thyroid activity, but it balances the reactions of thyroid activity through the next 3, 4, 5, and 6 stages of conjugation. And what does that mean? Well, when chemicals are produced in the body and they're exposed to, say, blood, they conjugate or they change in order to become part of what they need to do. And if they become part of parathyroid or pituitary, they change as they're exposed to other enzymes and coenzymes that become catalysts for reaction, and they take on different molecular signatures. That's what conjugation means. So seaweed is a great source of iodine and iodide, and unfortunately, unless you're Japanese, you're not getting a bunch of it. In Japan, it's a staple food. Now, you think about this. Thyroid function is a strong part of the immune system, and it's also very powerful as far as, correcting cellular matrices. So any abnormalities that occur, monoclonal antibodies associated with thyroxine are tripped or stimulated. For instance, exposure to radiation. No other country on the history of this planet has been exposed to as much radiation as the Japanese, and their incidence of specific types of cancer are actually lower than the global average. I found that extremely interesting. Also, if you're looking at the transfer factor, how much of the thyroxine and how much of iodine, for instance, crosses over from the gut into the bloodstream. And if you look at the system that substances have to go through in order to make their way into the bloodstream, it's quite complex. So, we're only looking at 2%. And of course, thyroid medications, we're looking at Synthroid and levothyroxine and some of the others like Armour, for instance. The problem with these is that they replace the function of the thyroid. Now let me ask you something. If I give you something that regularly takes the place of or replaces the function of an organ in your body, what happens to that organ tissue? It atrophies. It ceases to function. It functions less and less and less, and you become more and more and more dependent on the chemicals that replace that function. Really not a good practice. In some cases, it's survival. And I understand that. That's fine. But in cases where it's not survival, it's not a practical solution. Thyrogenesis offers a natural balance between iodine and iodide for maximum thyroid stimulation. And furthermore, Thyrogenesis contains L-tyrosine. Now, L-tyrosine increases the gut transfer from the low 2% to over 87%. Did you get that? 87% bioavailability transfer. That's incredible. It also helps to drive the T3, T4 uptake. What that means is how much of the thyroxine that's being produced is actually being circulated for the purposes of what? Metabolism. Because remember, as it gets broken down into metabolites, things that actually break down fats and sugars and proteins. It helps with the enzymatic exchange so that our bodies actually burn fuel more efficiently. It turns up the thermostat. It makes us more efficient. The result is greater energy. You see people like this. They're boundless energy. Also healthy hair. You know, the people with low thyroid function, they complain that their hair is dull and brittle and thinning out. No, that starts reversing almost immediately. Safe and predictable weight management. If you bring the thyroid under control, you'll start seeing metabolic changes almost immediately. Deep and restful sleep. Sleep is so important. The average person burns anywhere from 750 to 900 calories while they sleep, basal metabolism. That's how many calories you burn doing essentially nothing but sleeping. If you go into deeper sleep, you actually burn more calories. If you're circulating enough metabolites, that is to say, you're circulating enough to increase your metabolism while you sleep, you can burn anywhere from 12 to 1,500 calories. Strong, healthy nails. This is important to both men and women. I know men don't think about it as much, but if your nails are brittle and broken and they start breaking off on the edges and you start getting torn cuticles and so forth, that's not comfortable, and it makes it difficult for you to do things. You know, healthy nails is a sign. As a physician, when I look at the nails, the nail beds, I look for striations, and I also look for the color. And that tells me a lot about the health of the individual. Normal, healthy bowel movements. Well, he looks pretty happy. Well, you know, and we've talked about this in other slides. You know, 24-hour transition or transit time. So if you're eating 2 large meals a day, 1 small one, you should be at least going twice a day, right? Well, actually, an active thyroid helps with bowel metabolism, with breaking things down in the bowel enough that they become waste sooner. And then your lean body mass, increasing your muscle, decreasing your fat. And for some of us, myself included, it never used to be. Boy, when I was younger, I could hold on to muscle and I couldn't gain weight. You know, I'd have to intentionally abuse my diet to gain weight. Now, all I have to do is watch a commercial and I gain 5 pounds. So you want to be in a healthy BMI. You want to be in a healthy body lean mass capacity and less on the, shall we say, the adipose side. So who can safely take Thyrogenesis? Well, Thyrogenesis was formulated for adults. Yeah, it's not often when children have metabolic issues. When they do, we need to take a serious look at it. And that means doing some specific testing for the pediatric population. And I wouldn't start with Thyrogenesis with them because it could mean all kinds of different really serious health issues. Juvenile diabetes that was not diagnosed appropriately. Certain types of adrenal tumors or pituitary tumors or thyroid tumors that aren't that common, but neither are metabolic issues with children. So we'd have to take a closer look, and we'd work specifically with the pediatricians on this one, right? For adults, metabolic breakdown is not all that uncommon. Why? Because for the most part, it's a self-inflicted wound. You know, we live on processed food. We do things that break down our metabolism due to lifestyle. So we need to change those things as well. But as we look at the adult population, we can help with them in a very safe manner, knowing that most metabolic syndromes and metabolic failures are a part of lifestyle. We do, however, I mean, we can look at clinical evaluation. I can see when a person comes in that, you know, they're making lifestyle changes and they're trying to lose weight, then they've got some signs or symptoms of metabolic failure, possibly due to lack of thyroid activity. Doesn't mean I want to send them off and have, you know, synthetics put into their system. Absolutely not. But I'd like to have a baseline of information for the most part. So I recommend that patients go off and we can order for them some baseline blood work that tells us where you are with your metabolism and where you are with your general health. Do a comprehensive metabolic panel just to take a look at things. So do you have questions? I bet you do. I'm here for you. You just reach me at Dr. Stan at sanoglobalnutrition.com. We're going to be doing lots more of these. I hope you enjoy them as much as I enjoy doing them. I'll talk with you very soon. Take care. Bye-bye.